Hi, we're the Gray family.
I'm Aaron, I'm 13 years old and I've had a liver and small bowel transplant.
If it wasn't for organ donation, my son Aaron wouldn't be here with us today.
My name is John Forsyth. I'm a transplant surgeon. I'm involved in transplant of the liver, the kidney and the pancreas. I have been involved in many cases, from those who have donated very young to those much older. In each case there has been a tragedy which has happened, and organ donation has taken something good out of that tragedy.
Hi, I'm Lily, this is Bradley. We're Darryl Turley's family. It was something we hadn't discussed with Darryl. I know Darryl would be very proud, knowing that he's helped save lives or give people a better chance in life.
My name is Carolyn Reid and I'm a donor transplant coordinator. Personally, to me, organ donation is about supporting families through the decision-making process.
We're the Warden family, Rachel's family. What I mean about organ donation is turning something very negative into something positive.
I'm Dr. Stephen Cole. I'm a consultant in intensive care medicine. Well, my role is to return the critically injured patient back to their former health wherever possible, but in a small number of cases this isn't possible despite all our best efforts. These patients are not going to survive, and it's appropriate in some cases that among the end-of-life choices that we discuss with the next of kin, organ donation is among these. Patients die in intensive care from two major sources. They either die because of cardiac death, because their heart stops and they are no longer able to circulate their blood around the body, or because the basic functions of their brain are no longer working. These are the functions that make you breathe, that make your heart pump, that control your blood pressure. These are controlled in a very small area of the brain, situated right at the back of the brain. It's a very primitive area of the brain, and if this is not functioning, you cannot live. In terms of brain stem death, which is what we're talking about here, we have a number of preconditions which have to be met before we can even think about that diagnosis. We have to have an injury which is consistent with that diagnosis, and then two consultant doctors have to do two sets of tests to confirm that that brainstem death has taken place. And these involve tests of the nerves around the face and the nerves that control breathing. For example, we would open the patient's eyes, shine a light into the patient's eyes. If you imagine someone shining a bright light into your eye, your pupil contracts, it's slightly painful. That doesn't happen in a brainstem dead patient. We take a lot of care and a lot of time to make sure that we do this at the right time in the right patient and we get it right. After the first set of brainstem death tests, I would, together with a donor transplant coordinator, go and speak to the family. We would then discuss with the family that their loved one is dead, and we would then discuss with them potential end-of-life choices, which would, of course, include organ donation. We know that most people support organ donation. We know that most people would be happy to accept an organ should they be in need of one. But if you don't make your feelings clear, if you don't tell your family and your loved ones what you want to do, then you're asking them to make that decision for you at a time when they are terribly stressed and bereaved.
Just like every other wee girl that you kind of imagine, but obviously she's very, very special to ourselves. Life and soul of every party that she went to and everything that she took part in.
She was a ray of sunshine. Everywhere she went, as Craig said, she lit up everywhere.
Rachel was 11, so she was going from Golden Hill Primary to Clydebank High School. My sister was fine up until one night just happened. You think each day is going to keep on continuing. It's never going to happen to you.
And initially it looked as though she was taking a seizure. My mum had died with a brain hemorrhage, and I just knew when I seen her it was the same sort of thing. The ambulance came, they took her straight to York Hill where they put her into a coma and ventilated her. They did the CT scan then. The neurosurgeons at the Southern reviewed the films and said, you know, there was not much. They took me and Craig in, said, you know, it was a massive bleed, there wasn't much hope for her.
Everybody was brilliant, everybody fought as hard as they could, but it wasn't to be, you know. As I said, it's the worst thing that anybody could ever face.
I knew Rachel's wishes. I mean, she'd said from an early age, I mean, at 7 years old, she made me promise that if anything ever happened to her, that she would use her organs.
She's always wanted to do it because my dad's dad, my granddad, has also received a kidney, and he knew how good it was, that she knew the meaning of life.
I think it's a thing families should discuss. The worst thing for a parent is to lose a child. You never expect to outlive your children. But if a tragedy like this happens again, for the parents to know what the child's wishes are, or even the child to know what the parents' wishes are, it would make things so much easier.
Yeah.
And it would make things easier for professionals as well. You know, it must be a horrible job to approach someone, you know, that's losing a loved one and ask these questions.
If I'm going to die, which everyone will, I really want someone else to keep on living, to live the life I've lived.
We've received a letter from one of the chaps that got our kidney and our pancreas, and it was just amazing, absolutely amazing.
You know, it meant a lot to us, you know, and it was just really, really nice to get it. It really was. He's going to live life the way Rachel would have wanted to live her life.
I think people saw the organisation is just a beautiful thing. You're dying, but yet you can give people, to the most about 5 or 6 people, another chance of life.
I think the most important thing about organ donation for me is being there for the families and being with them and taking them through the whole process of donation. We'll also then go on to support the nursing and the medical staff within the intensive care unit. And if we know that you had authorised your wishes through putting your name on the organ donor register, that information we could give to your family, and then they are more than likely to say yes and agree with your wishes to go forward for organ donation. Within the whole of the UK, there are 16,400,000 people on the organ donor register, and within Scotland itself, there are just over 1.7 million people who have registered their wish to be an organ donor. The families of the donors just want to make sure that we're still caring for their family member, and that any of the organs that they have said that they are willing to donate find suitable recipients. When I see a family at the end of a donation process, and when we get letters from the recipients and we're able to forward that on again to the families, and speaking to the family on the phone at that point as well, they're always just so grateful for any piece of news or information that comes from the recipient families. I think families should discuss organ donation amongst themselves and make a decision, knowing that all their family members know what their decision is.
He was a lovely, energetic 13-year-old, the youngest of my 2 sons. I would say his main hobby was football. He was in the school football team, and he was in an outside football team, and he was in the PAC, which is I think, Pike Anglers Association for fishing in Scotland. He was a junior champion, the junior daddy they called him in the magazine actually. His biggest catch was a 23-ton pike, and that was only the week before he was killed, which is an achievement for a youngster. I was actually at my work, and I get a phone call from my husband. Basically just told me there had been a road accident. Darryl had been hit with a motorbike. My immediate thoughts were, is he going to be okay? And Davy said, he looks bad. It's a head wound. And it wasn't until the next morning there had been a deterioration in Darryl's condition. His brain swelled. And we were told then that there was no hope for him. There was nothing they could do to save him. We decided almost immediately, well, within minutes, my husband and my older son, within minutes, go ahead. Bradley understands that Darryl's heart and other organs have went to help, don't you, son? How do you feel about it? Brad?
Happy because he's saving other people.
Darryl's heart, his kidneys, his liver and his lower bowel. And I just pray to God that the recipient is doing well. All the recipients are doing well. It's a positive way, I believe. If you turn it around and imagine it as one of your family, if they could receive and it would make them better, I'd give them a better quality of life. I still believe that we've did the right thing. I've never, ever had second thoughts or regretted.
Organ donation is what happens when somebody dies in hospital in certain circumstances. And we are able to remove the organs from that dead person and transplant the organs into somebody who needs them to save their lives. Transplant is immensely successful. People who are very close to death can be transformed within a matter of a few weeks. And the results are, let's say, 1 year after a liver or a kidney transplant, 90% of people will be alive and well. Quite often I will be passing somebody in the corridor and they will say, "Mr. Forsyth, you're not speaking to me today." And it's because I cannot recognize them. They have changed so much from that ill person that I saw before. Today there are a large number of patients waiting for a transplant across the UK, and most of those will be waiting for a kidney transplant. There are two reasons for that. First of all, because kidney disease is pretty common, but secondly, of course, we have dialysis, which can keep those people alive whilst they wait for a transplant. Most people are aware of heart transplants and lung transplants, but there are other organs, such as pancreas, which can be transplanted for certain patients who are diabetic. And beyond that, there is tissue transplantation, which is talking about things like skin, bone, and even parts of the eye which can be transplanted, such as the cornea, which can give sight again. So there are, from one tragedy, from one death, there can be many organs and many tissues donated. For me, I don't feel like I save people's lives. I feel like actually it's the donor and the donor family who have made the difficult choice that they have made. They are the ones who truly allow the life to be saved. Myself and the whole team who perform the transplant, we allow that to happen. But the most important thing is the donation. I would say that organ donation means a tragedy that has occurred, but that something positive can come out of that tragedy. And therefore we should consider what we want to do in terms of organ donation, and we should discuss that with our family.
Well, Arden was born with a heart disorder.
He was only given hours to live at one point.
It was discovered he had a horrible thing called necrotizing enterocolitis, which really just eats and destroys the intestines. So he lost probably about 3/4 of his small bowel. He had no absorption, so he had to be intravenously fed. It reached a point where, you know, how they were treating him actually wasn't any good for his liver, so he got liver disease as well.
I was 3 years old when I had my transplant, and obviously I didn't know much about it, but being 13 now, understanding what I went through, I'm happy to be alive, obviously.
And he certainly wouldn't be here today if it wasn't for organ donation. And really just, it's such a tragic time in a family's life to lose someone, to even consider organ donation. It is literally a gift of life.
Well, I really like the idea of organ donation. Like, if you died, you could make someone else live, and there's a slogan for it, I think, live life and give life, and I think that's a really good slogan.
In Arden's case, where it was a small bowel transplant, it has to be a child donor. So we knew that another family were going to have to lose a child for our son to survive.
Like my mum said, someone had to die for me to stay alive, which I felt really unhappy about, because when I first knew about it, I thought that child deserved to live rather than me.
Arden's transplant anniversary, every year I'll send a card or a letter, at least if the donor family are to know that, having lost somebody tragically, that, you know, there's a legacy that lives on, you know, that there's life goes on.
I'm feeling good. My life's been quite fun. Competing in the British Transplant Games, which I've only just came back from. I think I want to go back snowboarding again. Quite desperate to do that again, and My dream is to become a footballer for my team.
We're just so proud of Rachel.
Very, very proud. It's just pride.
Really pride. That's the thing, that she's given life to other people because she was life.
You couldn't give the same gift in money.
When you're gone, you're gone. If your organs can help somebody else, it could be yourself, it could be your own family that's needing.
Don't waste those organs. They are life-giving, literally. You know, they can save so many lives.